The policy launch date is planned for October the 1st of 2020. We're still working on how best to integrate the declaration of interest form into our editorial management systems. Some of you will be aware that we are right in the middle, or actually kind of getting very close to the end of a process where we're selecting a new vendor to provide our editorial management system, and therefore moving away from Archie. So right now, exactly how we're going to integrate how we're going to manage the declarations of interest forms and what kind of changes there will be in regard to that is tied up with this new editorial management system. But we are committed to making sure that we've kind of really that we've streamlined that process, and until the governing board is confident that we've got, that process is robust, then we won't be launching the policy. But at the moment, we're still on track for an October 1st launch. As I mentioned before, we need to revise the form, and we've pretty much done that, because we've got new questions. We've got new elements to the policy. Therefore, those have to be drawn out specifically in the form of new questions. And again, like we certainly won't be launching a policy without a new declaration of interest form. Okay, next slide, Ollie. All right, so a really important thing for everybody to be aware of, whether in review groups or amongst authors, is when the policy applies. So I've said the launch date is the 1st of October. So from the 1st of October onwards, the 2020 policy applies to all new Cochrane Review titles that are registered. It also applies to any review where the update begins after October the 1st in 2020. The 2014 policy will apply to any work that started before the policy launch date. So that is, if a title was registered, or protocol's underway, or it's been published, or the review's underway, anything where work is underway before the policy is launched, that stays under the 2014 policy. And if we just have the next slide, please. Just to kind of show that as a visual representation, show this we've got on the in blue to the left of the midway point. So the vertical line is policy launch, and actually, sorry, that should have said October. My apologies, I should have fixed that up. But that's the launch. That's the launch point, the point at which the policy comes into effect. So in blue is the 2014 policy, and in purple is the 2020 policy. So in the first example, the first row, title was registered, the protocol's published, the review's published, that all happens, and all of that happens before the new policy is launched. Then clearly the 2014 rules, the 2014 policy applies. At the point where that review is going to be updated, if that occurs after the 2020 policy has been launched, then the 2020 policy applies. In the second row, you'll have situations where the title's been registered, the protocol's been published, but the review hasn't yet been published. That still stays under the 2014 policy. The key point here is that we're not applying the policy retrospectively. It's the same if only the title's been registered and you haven't got a published protocol or indeed a published review. So we aren't expecting review groups to have to completely reorganize author teams where the work is already underway. So to be fair to those teams, when they signed up to do a review, they did so under the 2014 policy. As long as they comply to the 2014 policy, then we're not asking them to change. It's only when an update has to be done, and that update happens after October the 1st this year. And obviously, the last row is where a title is registered after the policy is launched. So from that point onwards, the 2020 policy applies. Okay, next slide, Ollie. So the new policy is has been clear about responsibilities for various, within various groups. The authors are responsible for providing timely, accurate, and consistent declarations throughout the review life cycle. CRGs should not allow a title to be submitted after the policy launch. A title that's not allow a title to be submitted after the policy launch to be registered unless the author team complies with the policy. So basically, from the time the policy is launched, review groups need to be sure that when a title is registered, it complies with the new policy. And also, if a team, if an update is about to start, then it's also the CRG's responsibility to ensure that that author team still complies with the 2020 policy. The editorial and methods department are responsible for ensuring that other Cochrane Library content complies with the policy. So that includes editorials and Cochrane clinical answers. Next slide, Ollie. So we're now in the implementation period. The policy was actually announced back in March. As I said, doesn't come into effect until October. But during this implementation period, we have a research integrity senior editor and editor. Those are two quite new posts. And those individuals, along with other EMD staff, are working together as a COI implementation team. We have a working group where we're connected with Cochrane Council and with other departments within the central executive team, because this is a multi-department project. We work with the training team, we work with our colleagues in the on communications, we work with colleagues at IT. Sorry, dog just burst into the room. We've now created a COI portal, a web page which is going to have all COI policy information. Now, at the moment, it's got the 2014 policy and the 2020 policy. It also has other information, but we are going to develop more supporting materials, and we're going to be running training events. We've already run, this is one of several events that we've run so far, and we'll continue to do that up until the policy and after the policy is launched. Next slide. So we've run a couple of virtual workshops for managing editors, and we've got another one planned for a few weeks' time to cover our colleagues in Australia and New Zealand. If necessary, we'll run another introductory webinar in the coming months, a general introduction like this one for anyone, whether kind of from Cochrane review groups or outside, authors, editors, anyone who's interested. We'll probably run another one of those. We're very happy to deliver targeted training for groups within Cochrane, particularly the Cochrane Review Group networks. We're happy to attend network meetings or to run specific sessions for networks if that's helpful. And as I said, we will run webinars as needed after the launch, and look at kind of all of the ways that look at a variety of ways that we can deliver training. And the next slide, please, Ollie. So the kinds of things that we've been thinking about, and some of which, and in some cases we've already started working on. We've got We've already started working on online learning modules, sort of these mini modules that are based on real COI cases, very common cases that have come to the conflict of interest arbiters over the years. All the webinar recordings are available on the COI portal. We'll develop a list of frequently asked questions. We're working on a decision tree or flow chart, which will hopefully assist with people, particularly with review group staff, when they're trying to decide whether a particular case or a set of conflicts or a conflict complies with the policy. We're going to look at ways. We have already some information about the case referral process and the appeals process, but that will be changing, and we will be putting that information, and we'll be updating that, and probably perhaps putting a little bit more information about those processes than previously we had available. We're really interested, and we kind of spent some time talking to managing editors on the recent virtual workshops about the kinds of tools that they think could be helpful for authors, and so we certainly want to develop some of those, and perhaps work with Cochrane Council to kind of make sure that and perhaps pilot things with authors, or reach out specifically to author groups, so that authors as a group, so that they have a stronger sense of their responsibilities in regard to this policy. And our colleagues at PSD, which is our People Services Department, are interested in looking at ways of integrating education about the COI policy into staff induction packages. So for new staff starting, a kind of an introduction or an understanding of the policy as part of that process. And the next slide, I think, might be the last slide. No, yes, okay. So the portal is a nice, easy to remember URL, conflictofinterest.cochrane.org. We have a central inbox for queries about the policy, about either the current policy, the 2014 policy, or the new policy. You can send those to coiarbiter@cochrane.org.